Hi, my name is Karen and I want to talk to you about how to prevent a hospital stay for your loved one with dementia. No matter how great the reputation of a hospital may be, no matter how helpful the doctors and nurses are in a hospital, the hospital is one of the worst environments for a person with dementia. You're taking them out of their safe home environment, you're taking them out of their routine, you're putting them into a noisy atmosphere where they have people they've never seen before poking and prodding, and may actually set off increased anxiety and agitation to the point where a lot of hospitals feel that they need to restrain someone, which aggravates them even further. So no matter what the need is for a hospital stay, we want to do what we can to prevent one. When it comes to a person living with dementia, one of the biggest reasons for going to the hospital may be a change in their behavior. We can sometimes find that an increase in anxiety and agitation may be the result of an infection or a urinary tract infection, which is very common. One of the things that we can do to prevent a hospitalization is, rather than rushing them to the emergency room, calling the doctor, asking for an order for lab work to be done. It may not be easy to get a urine sample from them, but there are things that can be done to make that a little bit easier for you. So one of the things you can ask the doctor for is to tell you where you can get a hat, which is something that you place over the toilet to collect the urine, which makes it a heck of a lot easier than taking them to the emergency room and having them catheterized, which is not pleasant for anyone. Some of the other reasons for a hospital stay may be an infection. If they are running a fever, we need to try other ways to bring that fever down first before we think about sending them out to the hospital. Of course, always contact the doctor first. Try things like Tylenol, Advil, the usual fever reducers. Use warm or lukewarm washcloths at the base of their neck and their forehead to try and bring their temperature down. Have the doctor make an appointment with the doctor. I'd rather them go to the doctor's office than to the hospital or the emergency room. But find out what the reason for that fever is. A fever is not necessarily a reason to admit someone to the hospital, so do what you can to bring that fever down first before jumping the gun and taking them to the hospital. When someone isn't feeling well, when they've had an increase in anxiety and agitation, and it's maybe more than you are used to dealing with, contacting the doctor, letting them know what's happening is the best thing to do. They may be able to help you if you really need to have them admitted to the hospital. They may be able to do something called a direct admit if they have a relationship with the hospital that's closest to you. By doing that, they may order things like lab work and chest x-ray. Outside of that emergency room environment, which is very much a hustle and bustle environment, which increases anxiety and agitation, get those things done that are necessary for a hospital admission, but skipping over that stay in the emergency room. Always consult with your doctor before taking anybody to the emergency room, because they may have ideas based on their medical history about what can be done to prevent that hospital stay. Thanks for watching, and join us again for more caregiving tips.